Good morning.
Morning.
Good. I'm Dr. John, and I want to talk to you a little bit today, but at the same time, I want to try to make it flexible. Got it going?
Mm-hmm.
Okay. I want to try to make it flexible, and so if someone has any questions, or if the kind of my speech, informal speech, wants to go in a different direction, I try to always be open to that, and not be on a very structured format per se. Okay. But I started out growing as a small kid, when I was a little boy. Okay, I grew up in on a large farm, halfway between Memphis and Nashville, just off the Kentucky Lake area. And as a small child, I was surrounded by very gifted professionals, and they helped model me on what I am today. And so my uncle had a lot of influence in my life, and he was he ran a plant for DuPont. And what I found out is DuPont, they don't hire just your average engineer. You have to make straight A's before you get a job as an engineer for DuPont. And so a lot of these people I was acquainted with were from NASA, and all these larger corporations maybe have come down to DuPont. And then sometimes DuPont will maybe build a brand new plant. And so my uncle would fly in and kind of be in this new community where they were building the plant for several years to get the plant up and running. And at the same time, I was introduced to come down to the new plant and take a tour of the plant, introduced to all the top engineers in that community. And so, having a lot of knowledge and having the ability to tag along with the coattails of people that are more advanced in you can make a tremendous difference. And so, it was natural for me to go to college and become a mechanical engineer. Okay, during that process, and before I could graduate, we had to invent something. So something that didn't exist, we had to invent before I could graduate. Okay, and so then later in life, I did engineering for many years, and then I kind of went back to school and became a doctor. So that's what I practice now. My specialty is more called functional medicine. But at the same time, similar to my modeling as a small child, I felt like that I should be acquainted with the experts in the industry. Okay? So some of the areas I want to talk to you today is, like, as an example, one is cardiovascular disease. Okay? And so one of the guys that's made a tremendous impact in my personal health, my family's health, and many of my patients' health is a guy who's actually in Nashville, Tennessee. His name is Dr. Houston. He's one of the affiliate professors at Vanderbilt, and that he is the leading hypertension physician in the whole country, actually. Okay, that's his specialty. So the way I look at it is, you find, if you want to spend some time in cardiovascular, in the prevention side, and our approach is non-toxic approach. Okay, what that means is we try to use foundational dietary and also therapeutic means, meaning supplements, is to try to give increased quality of life and reduce risk for disease so you would not have an event early in life, a heart attack, we call it. Okay. If you wait until there's a problem, then that's a big problem. Usually you want to be on the preventive side, which is usually the best approach. And so that was my approach. Is you find who are the leading physician in the country on that specific specialty, and you ride his coattail. You go to seminars he's at, clinical workshops. You have breakfast meetings, you dinner meetings, in between workshops. You're always quizzing him, back and forth, and you find out the secrets to that specific area. Okay, and so that's what I've done in each of these different categories here. I want to talk to you today. And so you have my outline, but at the same time, I may bounce around a little bit. And so I do want to start off with cardiovascular disease. And so with cardiovascular disease, one of the things that naturally happens, and it's a normal aging process, okay? But however, with some people, because of genes or genetics, it happens earlier in life, okay? So what happens is it's a natural process for your arteries, which that's where the blood flows, right? Okay. You got about 5 miles of these arteries and veins throughout your body, and it's important for them to be elastic. Does that make sense? Okay. You want them arteries to be elastic. But what happens is it's a natural aging process for those arteries to become hardened. Okay? What that means is they don't stretch anymore. Okay? We want to be stretched when they're youthful, young, in the 20s and 30s, but then as you get older, then they stop stretching. Okay? And then they become more stiff and inflamed, and that's the starting process of hypertension. Okay? The arteries become inflamed, narrower, then the pressure goes up. It's hypertension. Okay? And so a lot of you in this room are very familiar with hypertension. Okay? Because you know, we see a lot of people in our clinic with hypertension. And so there's different ways to manage hypertension. Okay? One is blood pressure medicine. I think that's if it's extremely elevated, I think that's a good start. You know, of course, you know. But our specialty is starting to nourish the arteries, starting to reduce the aging process of those arteries so they become more younger, and now they're starting to become more elastic again. Okay? Has anyone ever heard that approach? Does that make sense? Okay. And so, believe it or not, that's completely changed my life. The reason why is because when I was in my late 20s, early 30s, I started having early signs of heart attacks at an early age. And mine was more genetic oriented because my uncle had his first heart attack when he was 21 years of age. Okay? And they said he would never live to be 30. His heart was so weakened. But in fact, that he lived to be 70 before he died. But at the same time, my dad had his first heart attack when he was about 51 years of age. Okay, and so now I'm 58 now. Okay, and so I haven't. So my heart is becoming. My arteries become more elastic, more healthy, less inflamed, and so this process has completely changed my life. You know, in many different ways. And so when we look at cardiovascular health. Beyond the the scans and the traditional one-page annual visit blood chemistry that you can get, there's you can open the door to many other different types of markers to assess your health and your risk factors. And so our clinic is contracted by a company called Boston Heart. Okay, and what we're looking at in Boston Heart is 4 different areas to assess risk for heart disease. Okay, and so one of them is something you're very familiar with, and it's basically cholesterol. Okay, you do want to have cholesterol because you need some cholesterol for your brain health. You don't want to have dementia. You don't want to lose memory. Okay, you want to have some cholesterol. You want your skin to be elastic. Okay, you want your fuel to burn slow and long. Okay, so you need some cholesterol. At the same time, but when it becomes elevated, it becomes a problem. So there's a marker we look at. We could look at triglycerides and HDL. Okay, so if you have too much triglycerides, your blood becomes thick, and then at the same time, you want to have protective cholesterol, HDL, which carries out the bad cholesterol. Okay? So we want to shoot for a ratio of like 1 to 1 and 1.5. So you take the triglycerides, you divide it by HDL. That's around that 1 to 1 and 1.5 area. If it's high risk cardiovascular disease, it's 1 to 1 ratio. Other than that, it's 1 to 1.5. That's what we try to establish. And then we look at inflammation. We start measuring the inflammation inside the artery walls. And so I want to pass this out. You guys just kind of take a look at it as I'm talking, so you've got to be familiar with it. Just from this side and on this side here. Okay. And so think of an artery is this round tube. Okay. And then within that tube, you have the outside lining. Okay. And then also you have the muscle tissue of the lining. But also the inside is the most important. What happens on the inside of that artery? Okay. And so you have your the lining of the artery. Then you have the skin also on the inside of that area. So we're analyzing the inflammation forming inside that artery wall, if that makes sense. Okay. Because what happens is is inflammation starts to form in that inner wall, okay, you will never be able to see it on a scan, okay? Your cardiovascular physician will never be able to diagnose it this early in life. So we're trying to catch an event, 4 years to 10 years ahead of an event, if that makes sense. So we're doing that by analyzing early on inflammation that we can go ahead and reverse it at the same time. And so we have these different markers that we can do on this test called Boston Heart, which measures the inflammation inside the artery wall and also the health of the artery wall. And also it tells us how healthy your arteries are, if they're elastic, becoming stiff and inflamed. Okay. And so what happens is that if that inner wall becomes inflamed, okay, and no intervention is produced in your life, to say, you just the bad things that you could be eating or stressful lifestyle continues, to say, it grows and becomes more inflamed, okay, then the artery wall starts to become narrower, okay, hypertension starts occurring, okay, and then it can rupture, then it can form a blockage, and then you have a heart attack, okay. But instead of waiting for that to occur, okay, why not assess this with these risk markers? Let's have a risk marker test, okay, to analyze, is an inflammation occurring that we should be aware of, that we need to go ahead and start reducing, reversing that now, okay. The good news is that this specific lab coordinated a program out, and it's actually 100% contracted by Medicare, okay. What that means is, as long as you qualify, of course, it's a free charge. Medicare picks it up, okay. So that's a good thing. And so,
is it a blood test?
It is a blood test. Yeah, it sure is. It's a blood test. So we look at number one, lipids. Okay. Look at inflammation. We talked about that. And then let's talk about another one that what's very important for us is we look at how your body is metabolizing glucose in your body. Okay. And so when you eat food, that food converts to glucose, okay? And so our question is how is your body managing that glucose, okay? Is it able to burn up all the fuel of glucose that you're putting in your body? Is it able to burn that glucose up very efficiently and effectively, okay? Or is it too much and your body secretes a hormone from the pancreas called insulin, okay? So it scoops up that excess and it tries to push it into the cell to burn as fuel. Okay? But say if it's an excess for a long period of time, then it may not be able to push all that excess glucose into the cell to burn as fuel. Okay? And so then your glucose starts to become more elevated in your bloodstream. Okay? Now your doctor, he may not pay any attention to it until it starts to become like 110 or 120, okay? And that's okay, but our alert is we like to keep people in a very narrow range around 85 to 90, okay? So anything over 95, we start addressing at that time to try to reverse that effect. And then at the same time, because all this glucose is bombarding into the body, and also we're fighting against our genetics at the same time in our aging process. So as you become more aged, obviously your metabolism slows down because you don't have as many hormones as you used to when you were in the 20s and 30s. Okay. And so it's kind of a natural process for your body to not be able to, you won't be able to eat as many carbs as you used to. Okay, and so that's why I'm a big proponent on a low carb diet because of that. Because when you're older population, your body is just not going to be able to burn it like it used to. Okay, so we have to modify our diets. We can't eat the same diet as we're older as when we were younger. To say. So low carb diet is definitely has a lot of benefits to that. But what happens is if this glucose is not metabolized and it keeps going up, it can actually scratch the inner wall we talked about is very critical, the inner wall of the artery. It can scratch that inner wall. And when it scratches the inner wall, then inflammation starts occurring in that area. Okay. And so it's good to assess that, And at the same time, we look at genetics. Do you have, were you born with a large molecule size type of cholesterol? If you were born with a large molecule size, then it just bounces off the artery wall. It's not a big deal. Okay? But like myself, if you were born with a small molecule size, then it becomes much more higher risk. The reason why, it passes through the intestinal, the skin of the artery, and it can cause inflammation and plaque to start occurring early on. And so we measure these numbers, like we call it LPA. That's your small molecule size. Like how much LPA do you have in your blood system? The higher it is, the more risk that you have. Okay, so we have to metabolize that out, reduce that for lower risk for cardiovascular disease. And so that's part of genetics. That's something you really can't change. You were born with. But at the same time, we can change the expression and we can metabolize it and lower it if we need to. Anybody have any questions on that area?
Does the LPA become sticky?
Huh? That's an APOB. We call it APOB.
Okay.
It means your cholesterol is sticky. So it's another genetic marker that we measure at the same time.
So that would be different as opposed to a larger one versus the small.
Right.
The larger one wouldn't get like that.
Well, the larger means it's more buoyant.
Okay.
It bounces off, lower risk. LPA will give you a lot more attention, okay? Because that's a higher risk marker. Then there's other markers we look at. One of them is APOB, it means how sticky is your cholesterol. Okay. Yeah. And then there's some other markers we use is to measure like fibrogen. I don't know if you've heard of that marker before. It tells us how thick that cholesterol is in the blood system. Okay, good. And so also within that artery wall, we have to look and ask the question, what is attacking that artery wall from the outside? What kind of attack is going on in the artery wall? We call it the insult of that artery wall. So if you think about it, then it brings us to what we call the GI tract. Okay, we'll call it the gut. Okay, you got about 7 feet of large intestines in your gut. You got 32 foot of small intestines in your gut. Okay, and so our question in functional medicine, we always ask the question, what is growing in your GI tract? What is growing there? Okay, do you have things that are very healthy growing in your GI tract? And the healthy things would mean your defense. Do you have, as an example, say you owned a castle, okay, and then you wanted to buy all these jewels for your castle, diamonds, emeralds, different types of gold and silver, and so you of course you want to have a good army to protect your castle and also your jewels, okay, and at the same time, say your army decided to take a long Christmas break and go on vacation for 2 weeks, okay? And then the enemy was very aware of that, okay? And so they can come in and take your jewels from you, okay? So that's why we want to make sure that we have a strong army of defense in our GI tract, okay? And you've probably heard of some of these before, because this starts occurring at a very early age in your life. We call birth, okay? And part of during the, that's pretty early, isn't it? So at birth, what happens is some of us were very honored to have the mother's first milk. We call it colostrum. So within that colostrum, you get immune peptides, and it starts to forming the immune system of the GI tract, okay? And then your body brings in acidophilus, bifidobacillus, all the good flora of defense. So that's your army, let's say. Good, healthy probiotics, we call them, okay? And that forms your defense of your GI tract, okay? And that's important for you, okay? But however, if you have an antibiotic in the first, some event occurs, and they prescribe an antibiotic to you in the first 3 years of your life, then it destroys that immunity. You have to start all over again. Okay, And so, but the earlier you destroy it, the higher risk for, the more trouble it is to get it back, and also the higher risk for other diseases that you may have, depending upon genetics, whether it's dementia, cardiovascular disease, GI, gut inflammatory bowel. It would give you an increased risk because of that. However, it's never too late. Okay, you can start today. Okay, but we always know if this is occurring. So our question is, what is growing in your GI tract? Something has to occupy that space. Something has to. Okay, so if you took antibiotics, unfortunately, it destroys all immunity. So then, what's going to come in there and live? It's going to be your survivors would be either bacteria, okay, the bad guys, yeast, okay, or maybe you just happened to get COVID 2 years ago, okay. And so COVID, what it does, it eats up the good, healthy microbiome in the GI tract. It starts eating up our good army. COVID does. That's one thing that we've discovered about that process. And so at the same time, we have a poop test, a stool test called GI map, and it analyzes the defects in this microbiome system. We're analyzing, is your army still there, or is it left like 20 years ago? Okay. What kind of damage has occurred in that called lining of the GI? What happens is no intervention is done. Those bad guys have been occupying that space, and they have children, and then their children has children, and now they just they're very dominant in that GI tract there. And hey, you mind hand me one of those posters? I should have 2 posters there. Okay. And this may help you, maybe, but it kind of gives you an illustration here of the health of the GI tract here. This one is very tight tissue junctures, very healthy defense, and this is what we're going to be talking about here. This is average in my community, what I see here. Okay. This is very tight tissue structure, healthy defense. This is my community, what I see here. No healthy defense, and the bad guys are growing there in that area. And so what happens is just like in the arteries, think about that in the arteries, okay? We have a GI tract, part of the colon, okay? And also it has a lining to it, and that lining becomes very porous, and it starts leaking, okay? Because the bacteria, we talk about yeast, bacteria, candida, you've heard of these things maybe, okay? Parasites, they start eroding, maybe COVID, different viruses we're exposed to in our life, they start eroding that lining, okay, of the GI tract, okay? When it starts eroding, then it starts leaking. And you've got this, the bacteria, and that bacteria has to survive, right? It eats what you eat, okay? And if you don't eat the right foods, it starts craving those foods, okay? And so it wants to be fed to stay alive, and it's always fighting for that, okay? It drives your cravings in a lot of ways. If you don't believe me, try to stop eating that food, okay? It'll start screaming at you, and somebody will win. You determine who wins first. So it has to secrete waste also, okay? And so we call it biotoxins. It starts leaking through, okay? So you've got yeast leaking through, bacteria leaking through, biotoxins leaking through, maybe undigested food now leaking through, okay? And then it's bombarding our arteries, okay? The insults in our arteries, okay? And so it can cause damage to the arteries just because of that at the same time. But at the same time, our immune system goes haywire, okay, in our GI tract. It starts producing these inflammatory cytokines because the immune system doesn't recognize all these bacteria. It starts to attack, okay? And because of the attack, it creates its own inflammatory response, which further erodes that lining even more, okay? And so this is we'll call the early signs, okay? Late stages, okay, would be different diagnoses and diseases, different types of inflammatory bowel disorders. That's kind of late stage. We're trying to catch it early, okay? So we can maintain and preserve our quality of life, let's say, in later years, okay? Is this helping you at all?
Yes.
Yes.
Okay, good. All right, so this is kind of beyond that one page on your annual visit, okay, we're looking for. Think of it as This is like a VIP physical, okay? Usually only preserved for presidents of our countries, NFL athletes, okay? But now it's available to everyone, okay? Everyone can have good health. It's not preserved on just a few, okay? But now everybody can take place and have a healthy life, you see. So we talked about the cardiovascular health. We talked about the health of the microbiome, okay, a little bit. And let's talk about neuro health a little bit too, okay? So same thing we talked about the barrier in the GI start to break loose, become permeable, bacteria, yeast, biotoxins start to leak through, okay? And also, it can actually start to, some of those particles could be a lot more inflammatory than others, okay? Now I want to speak of one that you may be familiar with, okay? And what we're finding out is because of the way our farming community is changing, okay? We're trying to make our farming community more profitable, okay? And one way we're doing that is we use special type of seeds, okay? And they're able to grow that food at a very much shorter span than it used to, okay? And so we're accelerating that process by 2/3, okay? And that can have bad side effects because then that particular food can be very, very difficult to digest in our body. And when it's very, very difficult to digest, it becomes more inflammatory. And one of those is our wheat here in America, okay? I see patients from Europe that come over, and one of the things, first thing they complain about us is they cannot eat our wheat here. You know, they immediately get stomach aches when they start to eat our wheat that we produce here, because the seed is it's been changed so much that the gluten in that wheat has become very, very difficult to digest. Okay. I would probably say that 90% of all my patients have severe gluten intolerance. Okay. And they really don't know it. You know, I mean, they're not aware of it. Our physicians in our community are not trained in this specific specialty to say, so they really don't know it. And so then you may have a diagnosis, maybe classified, something else, but because it becomes so inflammatory, okay, that it can cause start to become degeneration of the brain, the body. So our brain, you may say, I'm just not, I can't, my brain is just not as youthful as it was, 20 years ago. Okay, I have foggy thinking. Okay, this is early risk factors that we look for. Okay, it's somewhat normal of the aging process, but it actually can be reversed at the same time. So we look at number one, what insults did you have? We know that different things will cause this increasing aging of the brain, and one of them is viruses. Okay, and so we know that most people in our community now have viruses that they have been diagnosed with in their life. Some viruses they're non-curable. Okay, and so what that means is those viruses are in 3 different stages. Okay, number one, you have a flare-up. Okay, you're going to know it. Okay, you're going to have exhaustion, memory loss. You'll have apparent symptoms of that. It's flare-up. You probably want to go to a doctor and have a test done. But a second one would be, it's not really in a flare-up. That means it's not acute, but there's some elevated activity going on in that viral load. Okay, and that's something that is hard to detect. But the 3 things I look for, okay, is number one, I do this test in our office, and you can do it in your home. You take your 2 thumbs, and you start with the jawline. You go underneath your jaw all the way back, and you're trying to find any swelling, soreness, or nodules in these lymph glands here underneath your jawline. Okay. And that could be one sign that your viral, we call it your viral load. Okay, it's not acute, but there's some activity going on that needs to be reduced, to say. Okay. And then we have all these tests that identify these, so I want to let you know. Okay. And then a sore throat or if fatigue, exhaustion easily. That's some of the signs that you have some viral activity going on. Okay. Or your immune system is abundant, healthy. You still have the virus, but it's fully managed. What that means is the viral load is low. You still have it, but it's in a low enough phase where you're not having symptoms from it. You understand? So those are all important things. Different insults we look for on brain health. Microbiome, good health, good health, good brain health. We look at it. Okay. We analyze the viral load. We look at exposures. Like when I was young, I was training to be an engineer. So I was working in a Ford motor company plant while I was in college, and I worked in the manufacturing area, and I was exposed to some extremely hazardous chemicals. Okay, and I'll be fighting for the rest of my life to get those chemicals out of me. Okay, I was exposed to so much that kind of flooded my whole body, including my brain. So we look at exposures in life. Maybe you worked in a farming community. Growing up, you might have been exposed to a lot of chemicals in that farming community. The same. And also we look at trauma. What kind of trauma have you been exposed to in your life? Great losses in your life, maybe abusive relationships in your life. Those different traumas can have an effect on your long-term brain health at the same time. And so whatever is dominant, that's one that needs to be worked on first, is resolving that. If it's chemical exposure, let's put you on a detox program. Open up your eliminated pathways so your body starts excreting more of those chemicals. Certain things are really, really tough to be bound. They want to bury themselves in the tissue and they don't want to let go. So we use chelating agents and binders to bind it, to help pull it out.
In the last minute that you have here, is there any parting advice that you could give the ladies?
Yeah, that's true. I appreciate you keeping me on track. I didn't do that. And so, cardiovascular health, especially in the area that we live in our community, is very critical. Wouldn't you agree?
Oh, yeah.
Okay, good. So there's one specific nutrient I feel like is the powerhouse. It is so critical to our body, and it's called nitric oxide. Okay, and nitric oxide can retard the artery aging health. Okay, and also it can relax the arteries, helping to modulate or reduce blood pressure if it's elevated. Okay. It can modulate. If it's too low, too high, it'll modulate that, bring it into balance. But that nutrient is so powerful that that would be my number one product to take.
Can you repeat the name of it?
NITRIC, nitric oxide support. Okay, and it's so powerful that we're offering a special. We'll give you 20% off. You walk in our clinic, you mention your group that you're attended today. We'll give you 20% off for the month of January. Okay. If you want to buy it for your friends, that's fine too. Just as many as you want to have. Okay. Unlimited supply. Okay. All right. So it's the most important thing. Okay.
What is it? Is it a pill or
It's capsule.
We have
Yeah.
a little.
It's something I take personally.
can you get it in food?
It's very very difficult to synthesize. It comes from beets. But it's very difficult to synthesize from beets to actually produce enough therapeutic form of nitric oxide. So because of that. Also, with that 20% off, we'll give you a free nitric oxide test in our office. It actually measures your present level of nitric oxide. That way you'll know before you start taking, you'll just assess where you are. We'll measure that, and then you can decide if you want it or not. And then, of course, we'll have that available. Go ahead.
I know you said some of these tests are covered by Medicare, but
Yeah.
are your services covered by Medicare?
Yeah. And so what happens is I feel like you deserve to be treated your best with nothing left out, no stone unturned. And because of that, I have to spend more than 15 minutes with you. Okay. So I'm going to spend up to 2 hours with you. Okay. Assessing risk of your what areas of health are at the most risk, so we can really testing in that specific area. And so because of that, my services are just kind of a cash-on basis as far as office visits. But our labs, we can file for that, there's insurance, happy on.
You were talking about leaky gut.
Yes.
So if you have a leaky gut, is that reparable? Or once it's leaky, can it not be fixed?
Yes. No. We can repair it in 90 days.
By doing what?
So first thing we do is we find out what's eroding that gut. We find out what is growing there. Bacteria, yeast. We actually analyze the species of overgrowth. Okay. What species, and then based upon the species that we find, then we can have a targeted program to eradicate, kill it off. So we're killing the bad guys that come in trying to steal your jewels, say. And then we're building up our defense at the same time. We're going to give you colostrum again, we'll call it immune peptide. And then we're going to start giving you therapeutic forms of good, healthy probiotics to start providing growth of your army, your defense in the GI.
Thank you.
Yeah.
You mentioned that with the inflammation
Uh-huh.
in the digestive system
Right.
and so forth,
Okay.
that you try to intervene before it becomes a disease.
Right.
Disease
Later.
meaning things like what, Crohn's and UC.
Yes, that's right. Yeah.
And
We
then
can still work with it. We can still reverse it. It becomes
you
more
can't
slower.
reverse it, but you can.
We can, but it's more slower process and a lot more expensive. At that time, it's a lot lower price always if you catch it early. So, yeah. But to me, it's like a poop test or a GI test is like a good annual visit. I did want to, if I can extend one more minute, is that okay? Okay. And so one of the areas, the fourth area that I didn't talk about, I want to just kind of mention it real briefly, is studies show, okay, that by the time you turn 60 years old, okay, most people lose half their muscle mass. So they've lost half their muscle mass by the age they turn 60. Okay, and so in our clinic, how we address that is we actually have a test that scans your body and it actually measures this. We look at cellular hydration, how much muscle you have. We're considered a research clinic, so we're the only clinic in the city of Memphis, Tennessee that can actually measure muscle mass in your body. And also we look at fat mass too to make sure in that ratio. And so we try to, from that lab test, we try to structure a foundational dietary program that is not like everybody else is doing, but it's very customized toward you specifically. Okay, so we know exactly how many calories your body's burning. If your body has low muscle, which most people do, then we're going to start forming your diet to start building those. We're going to incorporate building blocks of muscle, which are amino acids, which are meat, fish, chicken, eggs, cottage cheese, things like that. Good healthy things to start building those muscle tissues, like your heart muscle, muscle tissue, and also your muscles, legs, arms, things like that, to give you strength at the same time. And also, because most people have too much fat in relationship to muscle, the foods that are causing the influence of that fat to grow, we're going to start reducing that down. Okay, so that we'll make an exchange. We'll start losing fat composition, and we'll start gaining our muscle back. Okay, and so we've hired in our clinic, and then also went through a very intensive certification process, and so they're called lifestyle educators. Some people may call them health coaches, but in our clinic they're called lifestyle educators, and they're trained in very specific ways to manage different risk factors and diseases, okay, that you may experience, but also how to have a healthy body composition, to extend our future lower risk for disease, have a much more quality of life that we're dealing with, and that way we can have an opportunity to help others if we have a good healthy life and a good healthy body at the same time.
Thank you so much, Dr. Smothers.